Hello, this is Shoemaker, and I'm here today with Mason Goodman, who runs our Healthy Transitions Clinic. So we want to introduce it or update you on what we do at the Healthy Transitions Clinic today. Mason, what is the Healthy Transitions Clinic?
This is a clinic that's designed to address multiple medical issues that we see in patients that require a lot of intensive therapies and a lot of intensive time. The clinic is set up to see patients who have multiple medical complex issues, who are discharged from the hospital that cannot be seen in a reasonable period of time for whatever reason by the primary care physician. If a patient doesn't have a primary care physician, we see those patients as well. There are several other issues that may be referred in from primary physicians or specialty physicians that need additional time for education. If it's a new diagnosis, if it's a patient that is not doing well because of training issues or because of behavioral issues, we'll try to help when we can. We don't have a lot of answers for some of the behavioral issues, but we do the best we can with that. The focus on this clearly is education and trying to get the patient to understand the consequences of their disease process and lack of therapy if they choose not to address it.
Very good. What patients have the best outcomes? What kind of things are things we should, as providers, be trying to get into the transitions clinic?
I think it runs across a large gamut. If you look at numerically the people that have chronic illnesses that are frequent admitters to the hospital, or who have been admitted to the hospital or seen in the emergency room 2 or 3 times in a reasonably short period of time, those are ideal candidates for our program. People we see are people with various forms of lung disease of one form or another, cardiac disease, multiple comorbid conditions, diabetes. Sort of runs a gamut of a lot of end organ dysfunctions.
So are any of our patients who are sick enough that maybe need to go into the hospital, have a complex condition that's deteriorating, or those who have just been discharged would be good candidates?
Right, and depending on where they are in their timeline of their disease process, if it's something we can try to treat as an outpatient, that's what we attempt to do. Clearly, sometimes we have to use inpatient services as well.
But and you can do even infusions and see these patients for up to 30 days after they're referred or after discharge.
Right, and they're really, the time frame is fluid. I mean, if we're seeing a patient, usually we try to stabilize that patient within about 30 days and then return that patient back to the primary care physician.
So with this program, we've actually had some good outcomes that we've documented, and we've been able to grow it to other sites in the system. Do you want to comment on that?
Yes, I think just an example of one of the issues we had was a patient with very, very severe gastrointestinal disorder that required multiple surgical procedures that was treated both by gastroenterology as well as by general surgery. This person had both a G-tube and a J-tube, was having a very difficult time managing fluids, managing electrolytes. The patient required several different forms of infusions to keep things up. We were also able to work on a successful way of getting with the nutritional side, be able to actually keep the fluids that the patient was bringing out through the G-tube that was going into the J-tube and reinfusing those, and the patient has actually done extremely well. Recently was able to gain enough weight that they were able to have a more definitive surgical procedure.
I can imagine that patient in follow-up at my office after hospitalization, and I would have been very thankful for you to take over the care at that point in time.
Infusions alone for these types of patients can take 4 to 6 hours.
That's great. Very good. Well, thank you for sharing that, Mason. I think we want you guys to know today that we have a resource within the medical group to take care of these sickest patients. Those patients who you think are at risk for hospitalization, those patients who've utilized the ED multiple times, those patients who have been discharged and are maybe a little more than what we can handle in our primary care setting are great patients to see our transitions clinics. And Mason, if we can just finish, can you tell us the other sites we have? Clearly we have in Indianapolis, but where else are we at?
We're in Evansville. There's a transition clinic in Evansville. There's a transition clinic in Kokomo. I think there's one in Jennings County, and I think one soon to be in Anderson, I believe, if I remember correctly. So we've had some successes. We've been able to interrelate with many of these other clinics on patients that we see here that have to go back to those communities, where we're able to transition them back into their own communities with the help of their local transition clinic.
Very good. Thank you, Mason. Thank you.